Good morning. If I could have everyone's attention. Yes, good morning. You can say it back. Yeah, good morning. Thank you all. And welcome to the 2024 RCPA Capital Day. And I'm Richard Edley, President and CEO of RCPA. And we have a great program here today with several legislators. And thank you, Sherry Landis of the ARC of PA for being here as well. Now, to be honest, I'll just say a couple of opening words. Events like this sometimes is hard for RCPA because we represent, the good news is we represent almost 400 agencies and health systems in Pennsylvania across 9 divisions of Health and Human Services. And I love the strength and the diversity that brings to our message, having that many people as part of RCPA. On the flip side, though, that means every division has a lot of issues. And when it's budget season right now, there are a lot of issues. And so we'll just try to quickly go through some of these today, and then before I turn it over to the speakers. Now, across all of our divisions in human services, obviously workforce is still a massive issue. And probably one of the messages we bring to the legislature is not to forget that. Things didn't suddenly get better as COVID sort of slipped away from people. And this is related to the amount of administrative burden we place on our staff, direct support staff, clinicians, and so forth, and how much harder we make their job. But each division also has its own issues, and I wanted to just go over a couple real briefly. First, I have to begin with a thank you to Governor Shapiro. And thank you, Governor, for finally recognizing the critical need of adequately funding intellectual and developmental disability services. Yes, please. And with that, a true commitment to finally end the emergency wait list for services among the IDD population and eliminate it for good. Now, we also know that with a lot of these things, infusion of dollars into the budget, a 12% increase, a 6% retro increase, all amazing. But it's really how it's implemented and operationalized that now we have to watch. So we'll be working and staying very close to the Office of Developmental Programs to make sure those dollars really get out in an equitable way to all of our members. And at the same time, it's always a little difficult when you at a rally like this or a press conference like this saying, thank you so much, now here are some of our issues. It is a little difficult to have to talk both ways, but there are still issues. Even within ODP, there's a lot of unrest in the community, and we know about it. Selective contracting, performance-based contracting, decreasing CIS scores, issues with facility-based services versus community participation supports, next steps on the HR 212 Legislative Task Force report. There's lots of issues to discuss. So we applaud and celebrate our victories, but honestly, we can't stop there, and the fight continues. We also believe that the budget could have been a little stronger with mental health and a little more focused on the needs of county-based funding, on the need to properly fund school-based services through community providers in partnership with the schools. Things like that we are still hoping can get into the budget to better focus on mental health and substance use services. In terms of substance use services, probably the big issue is the legalization of marijuana. Now, we're kind of agnostic on that issue. I assume some of our substance use providers may have some issues, but in more and more meetings I'm having, it seems like that's an inevitable issue. Well, if it's inevitable, we just want to be at the table to talk about then what are going to be done with the proceeds. Will proceeds be put back into the treatment system? So I understand the debate about that. We just want to make sure it's done well. We also, in substance use, have to ensure the viability and continued success of the opioid centers of excellence and make sure that the funding is properly going to them as the system has been changing. And with physical disabilities and aging, similarly, in community health choices, making sure MCO payments make it to providers for adequate staff retention and network adequacy. We have to be funding the system. It can't all go into administrative and to overhead and to funding interesting initiatives in the future. We have to get the money out to staff. We also want to make sure that the Office of Long-Term Living is required to do a rate refresh. That just like in ODP, that they're required to look at all services within the system and make sure they're adequately funding. In light of that, I want to also recognize a small but fierce group of RCPA members, the brain injury providers. Brain injury providers provide a lot of the same services in intellectual and developmental disabilities, things like community group homes, home and community-based services, vocational services, yet received actually zero in this last budget and no increase since 2011. Their programs, we're not talking about theoretical problems. Programs are closing. People with brain injury needs are not being served. And what happens when you're not served, you end up in nursing homes inappropriately or at home with nothing. And that's really, in sum, what RCPA and its members are all about. We represent the safety net providers, and we want to make sure that services are available for all individuals, including those with the most serious and complex needs. We can't allow, in the budget negotiations or in our ongoing work with the legislators and with the departments, to have pockets of individuals and who need service not obtaining the needed services that they get, and particularly with concern on those with the most serious and significant disabilities. So again, thank you so much for coming here. Thanks all of you, and especially Step by Step. Look at all the orange shirts. Thank you so much for coming out. Now we have a number of speakers here today, so if we can get started, if I could find my notes. Our first speaker, Representative Stephen Kinsey. Democrat from Philadelphia, and who is chair of the House Human Services Committee and a member of the Pennsylvania House of Representatives since 2013. Representative Kinsey is a leader in the Democratic Caucus, former chairman of the Pennsylvania Legislative Black Caucus, and currently serves as co-chair of the House Bipartisan Caucus. A strong advocate for equitable education funding, human services, pathways for careers in human services, sustaining wages, and so forth. Representative Kinsey gets it. We've met many times, and it's a pleasure to be working with him, and it's a pleasure that you're here today.
Good morning. Come on, y'all. Good morning. Can I start by giving these folks a hand here? Join me in giving them a hand. And the reason I'm doing that is because, I've been up here for 12 years, and when I see folks that arrive early in the morning, they're on a mission to share with the legislature the importance of the work that's being done in their arena. We have to applaud that. And I want to applaud all of you for coming here also this morning, because you're sending a message of the importance and the need that we as legislators need to listen to. So I want to say thank you for that as well. For me, to stand here as chairman of the Human Service Committee, and as I look around with my colleagues and friends, this is probably the first time that I can recall having all four chairmen here. We have all four chairmen of the Human Service Committee that are standing here. And for me, it's important to recognize them, because as we get things done, whether it's in the House or the Senate side, we need the support of the chairmen as we usher through, I shouldn't say hustle, right? As we usher through legislation. It comes from the floor, goes to the actual committees, and then is voted upon. RCPA. I could have just simply said Rehabilitation and Community Providers Association, but RCPA has like a nice sound to it, and it's easier to say. But each and every day, RCPA members demonstrate their steadfast commitment to champion the rights and well-being of our most vulnerable citizens. Think about that for a second. Whether it's providing in-home supports to our seniors and those who are medically frail, whether it's providing supports to individuals with brain injuries, or just providing counseling, treatment, and services to those individuals who have substance use. RCPA members are on the front line. They're faced with numerous challenges. And some of those challenges go from just ensuring that they have staff to be there every single day, making sure that they have the resources to provide those services that the individuals need. I think back to my own upbringing, and some of you might know I work with folks, I'm from Philadelphia, I've worked with agencies that provided supports to folks with intellectual disabilities as well as folks with mental health. And it's interesting that as I stand here today, we're still faced with some of those same challenges from decades ago. I don't want to say how many decades, Chairman Haywood. I don't want to say how many decades, right? But decades ago, we're still dealing with the same issues. Some of those issues are shortage of staffing. And I don't care if you're in a rural area, suburban area, an urban area, underserved communities, or communities that do have the resources. The bottom line is that we still have to find a way to hire staff, to get staff there, to do the job, and provide those services that are necessary. Also, when I think about the mental health arena, I'm thinking about the out-of-pocket costs. Many of the folks who receive services, you know, we're grateful for Medicaid, we're grateful for Medicare. Keep that in mind, we're grateful for Medicare and Medicaid. But we also recognize that we have hundreds of thousands of folks who still don't have enough coverage. We have to do a better job to ensure that there's coverage for all Pennsylvanians to receive those services, no matter where you live in Pennsylvania. That's right, yeah, it's like, think about that. When I think about the work that I did working for agencies like Kincrest, Jevs, Horizon House, Spin, you know, we always dealt with a shortage of staff to get folks in there to provide the coverage 24 hours a day, 7 days a week. But also think about the lack of pay that those individuals received for the work that they've done. And you know, we have conversation now and we hear stories that you could probably make more in a box store than you can providing supports and services to our loved ones. Folks, we gotta find a way to change that. We have to find a way to ensure that we have a more vested interest into our vulnerable citizens. Another thing we have to do is we have to look at the complexity of the system. Many parents, grandparents have to deal with the bureaucracy just to ensure that their loved ones get services. We as a legislature have to find a way to change that. And there's a good start though. This governor, Governor Shapiro, he recognizes the dilemma. He recognizes the need. He recognizes that we have to find a way to support our vulnerable citizens. And so this governor has rolled out a proposed budget that include dollars to address the waiting list. This governor has included dollars to try to find a way to increase the rate of pay for those folks who provide the services. This governor believes in the work that RCPA and its members do. So let's make sure that we as a legislature understand that. Let's make sure that we as a legislature get behind the governor's proposed budget. Let's make sure that we as a legislator vote to ensure that the dollars are there to support RCPA and its members and those vulnerable citizens who need it. Folks, let's make sure that happens. Let's make sure that as you're here today, get behind, knock on doors, talk to legislators. Let's support those folks who need support. Let's make sure that we support RCPA and its members. Thank you very much. And I believe we're going to hear from my colleague, my good friend, Chairman Doyle Heffley, who was also Chairman of the Human Service Committee. Chairman.
Just a quick thing. I'll turn it over to Representative Heffley, but no, I'm not going to read the whole bio. Here's his bio. I'm going to read now. No, but I did want to say that among the things in his bio are things like fiscal responsibility, government transparency, and restoring government trust. Maybe we'll talk about that later. But thank you. Actually, working with both Representative Kinsey and Representative Heffley has been amazing. I would say the same thing for Representative Heffley in terms of him really understanding the issues and really wanting to work with us. I'm really happy you're here today.
Thank you. Thank you. It's an honor to be here, and welcome to the Capitol. I hope you take everything, all the sights and sounds of this beautiful place. It is an institution to democracy, and welcome, and thank you for being here. And thank you for the opportunity to address you today. Thank you, Chairman Kinsey. As the chairman of the Human Service Committee, I'm keenly aware of the importance of having quality services for citizens. Whether it's treatment to address mental health, substance use disorders, services for intellectual disabilities, we rely on our providers. Our providers must be able to rely on us. And I think Chairman Kinsey made a good point to that. Rely on us to support their efforts to retain and maintain staff and to ensure that the regulatory framework is manageable, providing the necessary flexibilities to address shifts in the workforce and other unanticipated challenges. One of these examples is something that was brought to my attention by some of my constituents and some of their clients in our district. And it has to deal with the community participation support waivers. And we look at, obviously we want to help make sure that our providers are reimbursed for the services, but we look at regulatory reform to make it easier for the families. One of the requirements supports a waiver that has certain requirements pertaining to percentage of time an individual receiving services must be in the community. And although the intent of the requirement is to provide social opportunities for individuals with intellectual disabilities, one size does not fit all. Some individuals want to be in the community, but some do not. It's imperative that we listen to the voices of those individuals and the providers that serve them. We must not lose sight of the big picture. This is about the individuals and their quality of life. We must facilitate the growth and expansion of quality services and providers to ensure that we provide the level of care that our citizens deserve. I thank you all for being here and wish you all the best in your advocacy today. God bless.
Thank you so much. Our next speaker is Representative Dan Miller, who has waived his bio. The only thing I will say is when you hear him speak, there is a reason why a couple of years ago he was named RCPA's Legislator of the Year. With that, Dan Miller.
Okay, good morning. Good morning. Welcome to the House. And we're here to make a difference. We're step by step. We got some self-advocates here, right? We see you and we are so glad you're here and thank you for coming. And let us know that this is the time for people to hear these voices. This is the time for us to actually do what we said we would do. And the governor has given us a little bit of the pathway forward, there's no doubt about it. But look, the reality of it is we come here year after year, not really demanding new programs, but demanding promises to be kept. That's the key. People have been waiting for opportunity to do what they love and provide the services. People have been waiting for the independence and opportunities to exist, for them to have the chance of living their life as fully as they would want it to be. Well, guess who can deliver it? We can deliver it here in this House, working with the governor, with our friends in the Senate, and hopefully bipartisan votes in the House, that we can be sure that help is delivered no matter what. And look, we all know DSPs need more money. This whole thing has been ridiculous. It's ridiculous. It is not right for DSPs to be working 3 jobs, to be duct taping their cars together, to be struggling to pay the bills, to do what they know how to do and provide that love. It is not right for people to go to work retail, which is good work, and make more money than a DSP, which is life-sustaining work. That's not right. It doesn't show our priorities. It doesn't show our heart. It doesn't show what we said we would do. Well, this is the year that we're going to start really making big changes. I feel it. You guys feel it? And look, we're not just here to talk about the needs of disability, because sure, there are massive needs there, but there are big needs too in mental health. And this is our chance this year here to invest into the systems that provide those opportunities and supports across the board. And that's what we're looking for. We want no one left behind with a diagnosis in the state of Pennsylvania. We want to keep the promises that have been waiting for years, and we want people, no matter where you are in this state, to know that you have a chance to have the opportunity that you've long been waiting for. You can build your future in Pennsylvania no matter what your diagnosis is. You are welcome here, and the work that will be done to provide those services will be fairly paid for in that process. Now that doesn't sound like too much. That doesn't sound like too much. I know that if we actually did everything the governor's budget said to do, we'd still have $11 billion in that rainy day fund. But look, we need system changes. System changes. I don't need a one-off. I need system changes that are sustainable, that allow people to know that their work will be there, grow with them. They can make careers of providing those services. We need people who know that no matter what their diagnosis may be, that those needs will be met in Pennsylvania, whether it be transportation, anything when it comes to assistive technology, that will be met here in Pennsylvania, and you won't be on a waiting list. And speaking of waiting lists, I'm tired of waiting lists. I'm tired of it. It is a moral failure in our state, as blessed as ours, that we still have thousands and thousands of Pennsylvanians and their families waiting for promises to be kept. While we sit in this building with $14 billion in a rainy day fund, other states have taken it upon themselves to correct that moral failure. For some reason in Pennsylvania, we decide not to. Now again, the governor has taken a step forward. I appreciate that. I know the governor cares about these issues. I know we're going to see the best budget that I've probably ever seen for disability and mental health services. But the goal must be that when it comes to disability and mental health in Pennsylvania, waiting lists do not exist. What do you think? You all right? Yeah? All right, listen, I want to thank everybody for the moment. RCPA does such a great job in bringing people together. I know we have friends on both sides who are going to say a couple words. All I can tell you is this, from the whip's office and the majority house caucus, we are committed to working to get this done with the best budget possible here at the end of June. We need your support. Thank you so much, advocates, for coming out here. Please, please, please keep in touch. Keep sending those emails. God bless. Thank you for the time.
Make sure you recognize Dan Williams as a member of the Human Service Committee. He's going to be here now, so with Dan Williams.
Okay, now we answer the question of who wants to follow Dan Miller. But no, wanted to recognize Representative Dan Williams here, also part of the House Human Services Committee. So if we could hear. And thank you so much for listening in. Now, so we'll answer the question by calling on Sherry Landis. Sherry Landis is easily one of the best-known disability rights professionals and advocates in Pennsylvania, as the head of the ARC of PA, working with individuals and families with intellectual and developmental disabilities. RCPA does a lot of partnering work with the ARC. I'm happy to say Sherry and I agree on 100% of everything. And so it's great to have you here today. Sherry Landis.
Thanks, Richard, and thanks, Representative Miller, for making this an impossible job now, right? And thank you all. I also have to shout out to everybody here. This may look like an easy job getting to this building. These folks make it look really simple, but it really takes an effort. It takes a team effort to make sure that their voices are heard in this building as well. The ARC of Pennsylvania is the state's leading advocacy organization for people with intellectual and developmental disabilities and their families. On behalf of our 8,000 members and our 30 chapters across the Commonwealth, thank you, Governor Shapiro, for the proposed $480 million increase in funding in this year's budget. We cannot be more grateful. This unprecedented investment in the home and community-based system for people with IDD, their families, and the direct support professionals who provide services will assist in the stabilization of our system. The funding will enable providers to recruit and retain highly trained direct support professionals to provide critically needed services. The funding will allow the Department of Human Services, Office of Developmental Services, to launch a multi-year growth strategy to expand services and work towards ending the emergency waiting list. And for those of you who do not know what an emergency waiting list is, it is people who need critical care yesterday. They are waiting for services because a loved one or the person who is providing those services may be dying and they have nowhere else to go. These are entitled services, and we continue to have almost 6,000 people on the emergency waiting list, and that has to stop. Today, we are asking members of the House and Senate to pass a budget that maintains the proposed $480 million. House and Senate members, please support your constituents, and I'm underlining that. It's not me, it's not Richard, it is your constituents in your district who have been waiting for years to receive the services they are entitled to receive, who are direct support professionals that have been providing care and support to individuals at a wage less than most service industry. Those people are also the folks that Dan Miller talked about, duct taping cars together, 3 jobs, but they continue to show up every single day to provide those services. We also are asking to support those folks, your constituents, who had to quit their job in order to stay home to take care of a loved one because there are no DSPs to provide that care. The $480 million investment is not a partisan issue. This investment is what the people with intellectual and developmental disabilities have been waiting for decades. We cannot wait any longer. Members of the House and Senate, please do the right thing. Pass a budget that maintains the $480 million.
And now we have our last 2 speakers. I know you've been here a while, hang in there, but it's very important to the process. I hope everyone's picking up the signs. Some small, but they all get right to the point. Thank you very much, supporting our staff and standing for disability rights. The next speaker is Senator Frank Farry. He's new to the Senate after having spent 7 terms in the House from Bucks County. And we worked so closely with Frank and his office in both those roles, and it's been a tremendous support to RCPA and our members, and we really appreciate all of that. As you'll hear from his remarks, there's also a reason why the senator was a past recipient of the RCPA's Legislative Leadership Award. So thank you very much for being here. Appreciate it.
Thank you, Richard, and thank you for being here. To the RCPA staff, the providers that are members of your organization, we thank you for the services you provide to the residents of this Commonwealth. What I'm going to talk about today is not meant to take away from the increase in funding increasing rates, the workforce issues, because we know they exist and we're supporters to get those areas grown and make sure that they have what is needed so these services can be provided by the RCPA providers. But what I'm going to talk about specifically is a report that was just released by the Joint State Government Commission, almost 150 pages here. It was released last month, and this report was born from a resolution that was passed by the House of Representatives with bipartisan support a mere 2 years ago, and that formed a task force to study the Department of Developmental Programs and to see what services they are providing the individuals in this Commonwealth. Richard actually served on that task force, and I thank you for taking the time to do that. Chairman Heffley touched on choice, and he touched on the complexities of the waivers, and that individuals sometimes are not provided choice in this Commonwealth. Well, this study highlights what we already knew existed. I'm going to quote two specific parts. One is, choice is illusionary if the decision is between no service or only one being presented to you. Think about that. And we're talking about where you live, where you work, and what services are provided to you. Choice is illusionary if the decision is between no service or the only one being presented to you. That's pretty profound. I think it's important that the men and women that are behind me and to my left have choice in where they work, where they live, and the services that are provided. Do we agree? The number one recommendation: promote freedom of choice. The desires and needs of the individual should be paramount in all decision making. Number one recommendation from this 150-page study. So I want to thank all of those that took the time to partake in this study and develop this information, because this is a blueprint for the men and women that serve in the House and the Senate and those that are in the Office of Developmental Programs to understand your needs and to ensure your needs are being met. So we will continue to lead with that. We now have a study that backs up what we know has gone on. Chairman Heffley talked about what's going on in his community. As a former chair of the Human Services Committee in the House, I heard from guardians and parents and loved ones, as well as individuals, that Pennsylvania is not providing the right choices for your services, where you live and where you work. And I am committed with my colleagues to lead in a bipartisan way to ensure that choice is met. So thank you for being here. Richard, thank you, and RCPA for all you do. And we'll continue to try and make Pennsylvania a better place for our individuals with disabilities. Thank you.
And now our final speaker of the day, Senator Art Haywood. From Northwest Philadelphia and Eastern Montgomery County, Pennsylvania's 4th Senate District. Now, this truly is a bio that would be here all morning trying to read through all the accomplishments. I wave bio. He's another one waving by, but I will say it's things like affordable housing, combating racism, domestic and sexual violence, childcare access, and so forth. You quickly learn why he is a friend to RCPA, and really appreciate you coming out here today.
As a child, my next door neighbor was Ricky Malik. Ricky had intellectual disabilities. Ricky was taken care of by his mother and father, Mr. Malik and Mrs. Malik. This was in the 1960s. And they knew that Ricky deserved treatment at home, care at home. Now, sometimes Ricky would be loud and groan. And when I was about 6 or 7, I was afraid of Ricky at that time. But I grew to know Ricky somewhat. And I think at some level I grew to appreciate Ricky. But I really appreciated Mr. and Mrs. Malik, because at that time, they didn't have a wide range of support to help them. It was all on them. But they recognized the dignity of Ricky and the love for Ricky. And it is for all of the Rickies who also deserve dignity, love, and the care from folks who are well-funded and well cared for themselves to take care of all of the Rickies. And I thank you for that. That work cannot be done for under $17 an hour. Now, as an adult, I represented Gaudensia Inc., well-known detox center. And Gaudensia grew from a small organization of Mike Carell and Mickey Moyle and David Slinger in 1968 to have detox and substance abuse responses across the Commonwealth and across this region. And what I saw from the work of Gaudensia was that former users, because most of those leaders, as you know, have been users, is that they were helping people to fight to save their lives from addiction. Fight so that their children would not be taken away from them. Fight not just with withdrawal, fight with access to housing, fight with access to public services. And one of the things that Mickey told me, Mike as well, is that when we decide not to fund the programs that support these individuals, they don't go away. The funding may go away, but the individuals do not go away, and they still need our support. And this is why I'm so excited about the Shapiro budget and committed to it. Folks who are struggling with substance abuse also have dignity. And so I shared as a child, I shared as an adult my experiences, and then I came here and became a Pennsylvania State Senator and was appointed chair of the Health and Human Services Committee. And upon that appointment, we decided to go around the Commonwealth to find out how people were trying to get out of poverty. And we did a long poverty report. It's still available for anybody who wants to spend time reading it, or the executive summary. And what we learned in part during this poverty report and the tour, in talking to individual after individual, is that mental health conditions are a significant contributor to poverty in Pennsylvania. Individuals share stories of getting mental health assistance for a time and then not having it. Children being taken away from them for a time and then struggling to get them back. Being homeless for a time and then finding housing. But we heard over and over and over about the lack of access to mental health, the wait times. And so a number of the former speakers have talked about the system changes that we need, and we need them. We've talked about the funding that we need, and we need it. But at the heart of what we have to do in this Commonwealth is to recognize that whether you have an intellectual disability, whether you are a substance abuser, whether you have mental health issues and need mental health treatment, you have dignity. And this is a dignity that needs to be respected, whether it is through public, private funding. This is the core dignity that needs to be shown through all of our recognition of some of the most vulnerable people in the Commonwealth. Again, I want to thank you, Richard, thank the organization, thanks all those who are doing the work. And this is certainly a call to action for us here in the General Assembly. Thank you.
Thank you so much, Senator Haywood. So I want to conclude the program with a quick story. That's just what you wanted. A few years ago, I was actually invited to an elementary school. Some of you have heard this, I'm sure, when I've talked in other meetings. An elementary school to explain what it is I do. You can imagine the excitement on the kindergarten and first graders. And true story, and I'll digress for a minute, I was third on the agenda behind a firefighter and a park ranger, and then me. But I did think it was important because, yes, they're kindergartners and first graders, but everyone needs to be educated on what it is we do and what it is we're trying to accomplish. And the real point of the story is when it all ended, one of the first graders, a young boy, came up to me dressed in his suit and tie, it was career day, and said, sir, and I was like, yeah, and he goes, good luck with your fight. So at least I think I got through to him at some level. And it's a shame that it is a fight, but it goes back to what I said at the beginning. We want to celebrate our successes, and there's a lot of good in governor's budget. But there are a lot of issues, and there's a lot of things that we just can't let up on. And that's our collective role. So again, thank you all for coming out here today, and thank you for all our speakers. Appreciate it.